So for this video, I'm going to gather the equipment and supplies needed prior to anesthetic induction. So the first thing I'm going to check to make sure that I have are 2 appropriate sized endotracheal tubes for my patient. I have a 10 and an 11, both are appropriate sizes for my patient. So the next thing I'm going to do is I'm going to take my syringe and I'm just going to check my tubes just to make sure that I don't have any leaks in them. So I'm going to inflate them both. First thing I'm going to do is just kind of look at them, make sure I don't see them actively deflating. In fact, I'm going to inflate this one just a little bit more. Everything looks good. So the second way I'm going to check them is I have a bowl of water here. I'm just going to kind of submerge and check for any air bubbles, which would indicate that there would be a leak. This one is okay. And this one is okay. So I will dry those off before using them in our patient. And then I'm just going to go ahead and deflate my cuffs for my tubes all the way. Okay. So now I'm just going to set them over here. And that's where we'll be doing our induction. Next thing I want to make sure we have is an appropriate tie for our endotracheal tubes. And this is a good length, and it also stretches a little bit, so it will be able to fit around our patient. And then the next thing I want to make sure too is that there is a syringe nearby, so we are able to inflate the cuff after induction as well. So after that, I have my 3 ml syringe here with heparinized saline. And the dilution that we use for our heparinized saline is 5 units of heparin per ml of saline. So for a 250 ml bottle of sterile saline, we had 1.24 ml of 1,000 unit per ml heparin solution. So now what I'm going to do is just make sure that I have my IV catheter and an IV catheter cap, appropriate size for my patient, 22 gauge 1-inch catheter. And I'm just going to go ahead and open my catheter and just take the cap off of my catheter, and we're just going to flush it with some of this heparinized saline solution. And I'm just going to place the cap back and place it back down here for the table. So after we've done that, next thing I want to do is just go ahead and make sure that I have my tape ready for my patient. So we're just going to go ahead and tape it right here, because this is the area that we'll be placing our catheter in. I like to get one more strip here. Little notch in it for extra security. So then after I have my tape prepared here, I'm going to get my VETT wrap, and we also use VETT wrap as kind of an extra security method for putting it around the catheter. And I'm just going to cut a little hole in there for the catheter, and we are good with that. I'm going to set it right here. So now the next thing I'm going to do is get my clippers, and I'm just going to kind of look at them, make sure they look clean. I don't see any debris or blood or anything on there, so that's good. And I'm also going to double check to make sure they are currently working and the battery is not low on them, because that happens, and we would not like that when we're shaving a leg for a catheter. So I have confirmed that, and it has a 40 blade on it, which is appropriate size. Next thing I'm going to do is just make sure that I have the appropriate scrub and rinse available here. So I have my chlorhexidine solution here, and I have my alcohol that we're going to follow it by, just to kind of clean the area before we place the catheter. And we do that 3 times. Next thing I'm going to make sure I have is my Pure Lube eye ointment, just to lubricate the eyes after induction. Don't want our patient's eyes drying out. And then the next thing that I'm going to get together is calculating the oxygen rate for my patient. So I have his anesthetic log here. and he is a 63.8 pound dog, so divided by 2.2, so he is 29 kilograms. And oops. So what I'm going to do is calculate the oxygen rate for him. So usually for induction and recovery, or during changes of anesthesia, we'll do like a 50 to 100 ml per kilogram per minute. So we'll go ahead and just calculate the 50. So we'll do 50 times 29, which is 1,450, and so milliliters. So then we'll basically transfer that into liters, which is 1.4 liters of oxygen per minute. And then for the 100, we'll do 100 times 29, which is 2,900 milliliters, which is 2.9 liters per minute. So that would be his induction or recovery rate. So I have both of those. Usually we like to start at the lower ends of the higher end, if that makes sense. So then we're going to calculate his maintenance dose, which is usually 20 to 40 milliliters per kilogram per minute. So again, we'll start with the lower end, do 20 times 29, which gives us 580 milliliters. So that would be 0.58 liters for oxygen. And then we'll do the same for the 40 ml. Let's see, 29 times 40 equals 1,160 mLs, which would be 1.1 liters oxygen per minute. So now that I have those doses here calculated, I'm just going to go ahead and write those on his anesthetic log, just so we know what appropriate doses of oxygen are for him. So the next thing I'm going to get prepared is making sure that I have a mask ready for pre-oxygenating him during induction or before induction. We usually do that for about 5 minutes. I'm just going to attach that to my hose here and just put it right over here. And then the next thing I want to make sure that I have after that is a properly working stethoscope. So we actually have 2 stethoscopes in the area, and both of them I have confirmed are working. So I always have a backup in case something happens with my first stethoscope. So the next thing I'm going to get prepared or make sure that I know where it is at is my emergency drugs. So we keep our emergency drugs right here in this drawer, which also has a lock on it just in case we're not around. But it is labeled emergency drugs on the front of the cabinet. And so we do have our emergency drugs available here. So I know where those are, and everybody else that works in the clinic knows where they are as well. But before the procedure, I will go ahead and just verify that they do know where these drugs are kept. So the next thing I'm going to make sure that I have set up correctly are my fluids. So I have my 100 ml bag of fluids here. I have the appropriate setup on there, a macro drip line connected to my fluid pump, which has a extension line on it as well. So that is prepared for my patient. So the next thing I will check to make sure I have are towels. The cold table surface can be a little uncomfortable for them, so I like to put a towel down for them to lay on. And then I also have an extra towel to cover them with, just in case they do get a little cold during the anesthetic procedure as well, because the temperature can drop. And then finally, the last thing I'm going to do is just confirm that I have everything together and everything looks okay on his anesthesia log here. And I am going to just make sure that I have his propofol dose ready to go, and it is near the induction area as well, just for the doctor to be able to have easy access to it. And that is how you prepare all your equipment and supplies prior to anesthetic induction.